Friends, there has been a record increase in the sales of sex pills reported from all the major metropolitans of India. Now, the question is whether these sex pills are good for your health or they are not good for your health. And in this video and this program, we will analyze that what is the best for you. Dear friends, any such medicine, single tablet in a small dose or high dose, if they can improve the sexual performance in men, such pills are called sex, sex pills. Some such pills or drugs are sold as an OTT product and some are prescribed by the doctors. And let us see which one is better. As I say, that some medicines are prescribed by the doctor and some you can get over the counter or online or through the word of mouth. Now the doctors mostly prescribe three category of drug, either sildenafil, tadalafil or vardenafil. But over the counter, the medicines by the name of testo boosters are making a killing. People have a conception that if my sex is down, that means my hormone testosterone must be down, and they are buying it blindly. Some medicines are sold in the name of health supplements, and some are sold as an Ayurvedic medicine, which consists of mostly ashwagandha, shilajit, gopru, ginseng, maca root, and newly introduced horny goat peat. But there is a but. Let us see which one is better. When the doctor prescribes sildenafil, he has a concept that any kind of dysfunction, which is known as erectile dysfunction, sildenafil is the first and the last word. Sildenafil has to work in all cases, but this is not the factor. This is not the truth. No, sildenafil is a short-acting medicine, whereas tadalafil is a long-acting medicine. Sildenafil has a strong action. It creates some side effects. Vardenafil is also a short-acting medicine, but creates less side effects. Now let us see the pros and cons of those prescription medicines. Firstly, the most important pros and cons is that these medicines are approved by the FDA. So they are confirmed medicines. But they have their own side effects. They, they can create headache, body ache, they can create dizziness, they can create vision problems, they can create stomach upset, they create nasal blockage, so on. But a doctor has to decide whether the disadvantages or the side effects outweigh the effects of the medicine. Now, coming to the non-scientific medicines, which are known as testo boosters or health supplements or ashwagandha, shilajit, etc. The first point is most of these drugs are ineffective on erection or erectile dysfunction. A testosterone can be raised, but that does not mean that it will increase the power of erection. In the era of 1950 and 60s, a testosterone was derived from the pregnant cow's urine. We took out the testosterone hormone from the pregnant cow's urine, and we injected to them. The people felt strong, bodily, physically fit, but they could not solve their sexual problems. Therefore, this testosterone hormone tablets or injections were not approved by the FDA. Also, the other medicines like health supplements and other things, their action is unpredictable. They may work on few cases, they may not work on most of the cases. Then these medicines are not well researched. There are unknown side effects which can lead to mysterious diseases and so on. These are the problems when you go to the medical store and take a medicine of your own, you are alone to face the side effects. A lot of OTC products are now being sold under the category of male performance enhancers, and there is a complex and psychologically defect in some or most of the men that their penis size is too small. And since time immemorial, for a very long time, about last 500-600 years, people are trying to find a product that increases their penis size. The basic concept of such psychology is that the bigger the penis size, the more excitement a woman will get. And therefore, penile pump was introduced into the market. People tried penile pump, did not work. Then a lot of varieties of penile pump came, battery operated, electric operated. And now again, new and new devices are coming out, but they have all failed in their set function. Now we talk about the medicines that can help in a person in getting an erection. Now, even if we say that the advantages of the erection is more than the side effects of the medicine, but still it is an puts the patient in a disadvantaged position. Why? It can increase the erection, but it cannot increase the sexual desire and wanting. Gradually, with the help of the medicine, the sexual desire becomes less and lesser. Now you don't have need a desire to get an erection. So that creates a dependence on the medicine, and that also destroys a natural relationship between the person. It also destroys the natural sexual chemistry within a person, and of course does not create any kind of emotional dissatisfaction. As a result of these disadvantages, these medicines do not work for a long time, not more than 6 months in most cases. Now we have seen the advantages or disadvantages of the sex pills. It's not sounding too encouraging. So we come to the importance of sex therapy. What a person gains from a sex therapy. Sex therapy helps to reduce the person's sexual anxiety. A sexual anxiety is a term when a person becomes anxious of performing just before the performance or before the erection, after the erection, but definitely before the penetration. So there goes the lot of problem. Sexual positional dilemma he gets into it. Therefore, his relationship or loving relationship with the wife gets affected. But in sex therapy, he can overcome all these problems. He can improve his sexual stamina. He can improve the quality of the orgasm, which he cannot do it with pills alone. Now we have seen that a sex therapy is irreplaceable. You cannot replace a sex therapy with a tablet or a medicine. But who is capable of giving you a sex therapist? A urologist, a general physician, a psychiatrist, or a sexologist? Normally, what happens, a urologist or a general physician prescribes only single medicine, mostly either a tadalafil or a sildenafil. A psychiatrist will add two medicines, a sildenafil or tadalafil, with some kind of an anxiety medicine, anti-anxiety medicine, which are helpful in controlling the generalized panic disorder. But these medicines fail in the cases of sexual anxiety because sexual anxiety will arise only when the person is in the act of sexual intercourse. Therefore, we suggest that the best person to go to is a sexologist who can analyze your problem in detail, who can take detailed history and give you a detailed explanation. When you go to a sexologist, the advantages that you get an improved desire, you get a better orgasm and arousal, you get a better satisfactory intercourse, you develop a better relation with your wife, the love between the partners increases, and there is definitely decrease in the sexual anxiety after talking to an expert in this field of sexual problems. Now, what does Dr. Gupta's clinic do? We have a team of a medical doctor and a clinical psychologist. A clinical psychologist can understand what his wife is undergoing. He can also understand what are the psychological dilemmas of his client. So, how to solve his relationship problem. So, she will understand that the wife is satisfied or dissatisfied only on the account of sexual problems, or there are other issues as well, home issues, domestic issues, career issues, or some kind of a interpersonal issues. Now, what does interpersonal issues means? The husband, the Maya, tends to get irritated very quickly, tends to take wrong decisions in life. When the wife tries to correct him, he became angry and irritated. And this reflects on the sexual performance. And when it reflects on the sexual performance, the person thinks that he has got an erectile dysfunction and tries to take a tablet and medicine to solve this problem. But the answer to the problem lies in settling down the interpersonal relationship. Why wife as a whole, as a person, dislikes the husband, vice versa, why the husband dislikes his wife. So these are the issues which is interrelated to erectile dysfunction, who can only get a solution when the team of medical doctor and a psychologist are working together. Therefore, sir, Dr. Gupta's clinic with its team delivers the world's best results about sexual problem.